Are ibuprofen blood thinners? No, ibuprofen is not a blood thinner. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by reducing inflammation and pain in the body. It does not have any direct effect on the thickness or thinness of the blood. Blood thinners, also known as anticoagulants, are medications that are specifically designed to prevent blood clotting. They work by interfering with the clotting mechanism in the body, thereby reducing the risk of blood clots forming in the blood vessels. Examples of blood thinners include warfarin, heparin, and rivaroxaban. These medications are often prescribed to individuals who are at an increased risk of developing blood clots, such as those with certain heart conditions, deep vein thrombosis, or a history of stroke. It is important to note that while ibuprofen does not directly thin the blood, it can still have an effect on blood clotting indirectly. Ibuprofen belongs to a class of drugs called NSAIDs, which can interfere with the platelets in the blood. Platelets are responsible for the initial stages of blood clot formation. Therefore, taking high doses of ibuprofen for a prolonged period may increase the risk of bleeding. If you are concerned about blood thinning or have a medical condition that requires the use of blood thinners, it is always best to consult with your healthcare provider before taking any medications, including ibuprofen. They can provide you with personalized advice based on your specific situation.